I'm Sarah Chaney and we're here at 30 Euston Square at the Royal College of General Practitioners and I'm the curator of the new exhibition, Unequal, A History of Health and Society. So I was really interested in the topic of health inequalities when I saw that this exhibition was being proposed. As I'm a historian of medicine and it's something that comes up a lot across medicine and public health, and particularly in general practice, I think, because GPs are so much a part of the communities that they serve. But it was something that I hadn't really explored in depth, and I certainly hadn't looked into the college archives either. So it was really fascinating to look into this new collection and to find out the stories both of individual GPs and the differences that they've made, of the challenges that have confronted them along the way, and also to talk to members as well. So to talk to the president and to the special interest groups for heritage and health equity, and really find out some of the stories that had shaped them and had inspired them, and things that really should feature in the exhibition content. The process of putting the exhibition together really started with talking to the members, particularly special interest groups around heritage and health equity, finding out what stories would be important to include, what work the Royal College of General Practitioners had done in the past, and then delving into the archive and finding out how we could actually tell that through the stories that were there. So looking at the objects that were in the collection, looking at the papers that were in the collection, starting from things like the Black Report in 1980, which was a key milestone really when the term health inequalities first started to be used, but then trying to look back as well and see what sort of things general practitioners have been doing earlier in the 20th century and back in the 19th century as well. So it's really trying to marry all those things together, the stories that we wanted to tell, the people that were part of this, both GPs and their patients, and then also tying that together with the things that were in the archive, with the really important historical collections that the college holds. One other thing that I did as part of the process was also reach out to the membership more widely. So we put something out in member newsletters asking people to share stories that they thought were important. And that brought up both really interesting new additions like Prince's Park Health Centre in Liverpool and the work that they'd done in the 1980s to really try and give a kind of holistic care to a community, providing all sorts of things under one roof and recognising that it wasn't just for their immediate healthcare needs that people were going to their GP surgery, but they also needed support with their lives and with their housing and with living costs and with everything that was going on around them. So having those stories come out from members who approached to tell their stories, so like Katie Gardner, who loaned some items for the story of the Prince's Park Health Centre, and then finding other loans as well to illustrate key stories that come up. So housing and health was something that came up a lot in the history, but there wasn't that much in the archives that could tell that story. So reached out to the Museum of Homelessness, and they have some amazing objects that actually tell the experiences of people who are experiencing homelessness and the struggles to get any sort of healthcare. So the exhibition will be on site at 30 Euston Square for the next year, and anyone can come in, visit the exhibition, have a look around, watch the videos as part of it. There's also an online exhibition which has some additional content in it as well, including the opportunity to hear the voices of some of the key figures like Julian Tudor Hart, who feature in the exhibitions. There's an extract from an oral history with him in the online exhibition. So members can expect to find some things that may be familiar to them or that they've heard of, things like the impact of the impact the Black Report should have had and perhaps didn't have at the time, and was picked up later on, and the concerns that the college had about that. But also I think some really interesting stories that they might not know, and particularly of work carried out by individual GPs. I'm thinking, for example, of George McGonigal, who was medical officer for health in Stockton-on-Tees during the Great Depression, and he carried out a lot of research into nutrition and the way this was impacting the health of patients in that community. And one very interesting study he did was around the move to new housing. So people who are moved to very modern housing estates thought to be moving away from the unhealthy housing of the slums, but in fact their health significantly declined. And McGonigal realised that this was one of the key factors in this was that their rent was doubled. So these people had far less money to spend on food. Many of them were unemployed during the Depression. So actually this move to new housing had impacted their health for the worse rather than for the better, as had been hoped.